technical issues, but we are now coming from a very professional setup. Thank you to Mr. Chu and Physio Matters and Chu's Media. So this is an important topic. This is something I think that doesn't need any introduction really, but I will introduce it in terms of, you know, throughout the pandemic, we have come together, I think, as an MSK professional network. It was something that was happening anyway, which is nice, but we were pushed forward and the fast forward button was pressed and forced into a time where we had to all work together and come together. And for me, that's been a really positive thing. And I know for a lot of my colleagues that you'll see and friends on the screen now, we want it to continue and we want to keep pushing forwards. I think there's a lot of things in the musculoskeletal field that we get right. I think there's some things that we don't, and I think there's things that we can improve on. So tonight is really just a little bit about that. It's about, you know, coming together with different people's views from different professions. We have physio, we have chiropractic, we have podiatrists, we have sports therapists, we have sports rehabilitators, and we have soft tissue therapists. So, you know, a broad selection of people that work in this industry. And, you know, from my point of view and a lot of others, we have one goal. We have a goal where we want to improve the lives of other people through therapy and for whatever that means. And I think it's something that's very, very fun to at the bottom of all of our hearts, as well as everybody that is in this profession, or I don't think we would do it. So obviously over the past 18, nearly 2 years now, we've been thrown a lot of challenges, but we have the chance now to push forward, maybe press a reset button, maybe reform practices a little bit. And that is basically what I think we all want to do. And make it a bit better. So again, apologies for the slight delay. I do love the restream here. It does look great. So thanks, Jack, for sorting that out. And we will get cracking. So it's being shared on various platforms. So please do join in. Please say hello. Please sort of engage. We can see all the chat functions. So we will bring you in and ask questions as and when. Fortunately, I can see everyone sort of saying hello. So that's great. What we will do now, without further ado, is I will just introduce everybody very briefly. Well, I won't. I will let everybody introduce themselves very briefly. Some of them you will know very well. Some of them you may not. I think the key thing here, team, is obviously your profession and the area that you sort of work in, so we can get an idea. And then we'll get cracking on some of our topic areas that we want to go through. So, Mr. Chu, let's start with you. So tell us about yourself in 1 minute. There you go. You've got a minute.
A whole minute. I'll just about get my name out in a minute. Right, fine. Hi, I'm Jack Chu, and yeah, thanks for joining us on this particular stream. It wasn't meant to be streamed through Physio Matters, but here we are, and pleasure to do that and to be able to help out that way. I'm a physio by background, and I find it interesting that I increasingly say that why am I not just saying I'm a physio? And increasingly I say it because I give less and less of a monkeys about that every day. Namely, not because of any sort of lack of pride in that, but more just that the fact that distinction, when shoulder to shoulder with my colleagues, particularly on this stream and beyond, within the MSK interprofessional networks that we have, that's why I end up saying I'm a physio by background and now an MSK therapist, and that tends to be where I end up. Admittedly, and where I'm excited for understanding and me learning more on this is I've hearing some. I've been talking about blurring lines, and then others that do feel that there are really crisp ones that need to be firmed up in some instances. And I think whilst understanding of that, I want to understand that position better to see if it persuades me. But really a pleasure to be here, and hopefully, for once, I'm under my minute.
That's impressive, Chu. Well done. Mr. Wyatt, tell us who you are and where you come from.
Thanks, Jemma. I'm Matt Wyatt. I'm a physio by background, but like Jack, would call myself an MSK clinician, or even more latterly, rehab therapist, because it probably sums up what I do better. I also work with Jack at MSK with Foreman and the Associate Director for Clinical Excellence, and are leading the agenda on competency-based over profession-specific recruitment. And I do a lot of work with NHS organisations on that very topic. So that's my passion: competency over professional tribalism.
Great. Nick Knight, Mr. Knight.
How are we doing, everyone? So thanks for asking me to come on. So I'm Nick. I am not a physio by background, and that's not because I don't want to call myself a physio. That's because my BSc wasn't in physiotherapy. It was actually in podiatry, but actually, like Jack, I don't really care about my title. I get called a physio, I get called a sports doc, I get called a dietitian on a daily basis, and I think everyone here would agree that actually it doesn't. My view is that I don't agree too much on the rule here, because actually, so for example, as a podiatrist today, I had an MRI come back for a patient on the 3rd who's got a handle tear for a million minutes. So I then sent off to the orthopedic meeting, but actually I'm a podiatrist by trade, so some people say, well, should I be in that? Shouldn't I be doing that? Well, I would say my training and my competencies allow me to do that. So it's all about just trying to get out there and tell the world that we can do as MSK therapists.
Thanks, Nick. You are a little bit muffled, so just if you just try and adjust your microphone for the next bit. So, Mr. Matthew Phillips. I always forget your second name. Is that your second name? I think so.
Tricky now. I used to be just the only Matt, but then Ashbrook appeared and it all went wrong.
It all went wrong.
Pear-shaped, yeah, ruined my life. But anyway, hey, thanks for inviting me along. Yeah, it's great. I mean, there's so much what everyone else has said so far. I do hope we're not on the same page for the rest of the whole show. But yeah, I'm a sports therapist by trade, originally strength and conditioning coach. And during my kind of 20 years or so in the profession, I wanted to be a physio, and then I realized I didn't need to be. I wanted to be an osteopath, realized I didn't want to need to be. I never wanted to be a chiropractor until I met Rob Bevan, and then I wanted to be. And I realized I didn't need to be. So, and then I've spent kind of the last 6 years, after 10 years in a multidisciplinary clinic, just kind of help soft tissue therapists, particularly sports massage therapists and sports therapists, realize that it's natural to want to be something else, because you always think the grass is green. Everyone knows everything, something more than you. I've just been trying to install confidence and help the sports therapy, particularly industry like that, by realizing it's like comparing apples to pears. You don't have to be something else. You just got to think what you want to do and be true to yourself and be good at what you do. So that's what I do with the Sports Therapy Association. I also have a company called One Check Live, which works predominantly with runners. But again, my whole ethos with that is treat the runner, the person, rather than the running injury. So that's kind of my background. And yeah, thanks again for inviting me.
Thank you, Leanne, as well. Somebody else who doesn't need any introduction. Tell us a little bit about you and what you do.
I've got a minute on your marks. So yeah, my name, listen, and the purple's out. I deliberately didn't wear purple today. My name's Leanne Antoine. I am a chartered physio. Am I going to say by background? I don't know. I'm also a talk show host for Chew It Over every second Tuesday of the month. I am a voiceover artist. I'm passionate about all things human behavior. And that is really my driver, to be honest, whether it's therapists and their behaviors, whether it's the patient and their behaviors. They're the kind of things that I'm passionate about and get my teeth stuck into. Most people will also know that I've recently been elected onto the Chartered Society of Physio Council board. So I'm embedding myself into that role and finding out a little bit more about physio from what seems much more corporate than the sort of hands-on clinical side of things that I would ordinarily do. So yeah, that's me in under a minute.
Mr. Rob Bevan, tell us a little bit about yourself.
So thanks for inviting me. Pleasure to be the only chiro here today. So yeah, I'm a chiropractor by background. Podcast host, and I run a multidisciplinary clinic in Cirencester, and we have physios, chiros, osteos, podiatrists, sports therapists, sports rehabilitators, which is kind of all working together, which has really blurred the lines between kind of all these professions. So I think kind of that's what, you know, gears us up to talking about this today. So thank you for the invite, and I'm looking forward to getting stuck into it.
Great. Ollie?
Evening. Ollie Coburn. I am very proudly a graduate sport rehabilitator. I work for BASRAT, as many people know, and advocate for our profession on a daily basis. I also do still work clinically, and I'm the MD of Freehab, the MSK social enterprise. So we've removed the financial barriers to people accessing care, and I'm proud to say that we have a multidisciplinary team, mainly because we'll take all the volunteers that we can get. And if there's anybody watching that wants to help, hit me up.
Great. Jane, thanks for joining us.
Well, thank you for having me. I'm Jane Ashbrook, and I'm proud to be a physiotherapist. And I enjoy working within a multidisciplinary team of different professionals. But I'm not a physio by background. I am a physio. I'm also a lecturer at Manchester Metropolitan University, and my passion is really around the blurred lines between MSK and the other specialities of therapy and physiotherapy, and you know, not thinking of people in holistic care, really, and inclusion health, and also in health promotion and health prevention for general well-being. So I'm really interested to hear about everyone's discussions this evening. And I do, just for one extra thing, I'm going to take longer than Jack now, is about 20 years ago, I went to work as an MSK physio in Bolton. And for the first time ever, I worked with a chiropractor that was employed by the NHS. And I thought that, you know, this is really good. This is really progressive. And I've never seen that ever again since 20 years ago. So we obviously haven't moved on quite that quickly.
Yeah, things need to change. And finally, our superstar Imi, who we have drafted in, and she's been amazing at coming in late notice, because maybe not on this chat, but we will talk about you know, the female lead role in public speaking and things like that. So thank you, Imi, for coming on, and I mean that in all seriousness. Tell us a little bit about you and what you do at the moment.
Thank you for having me. So I am a massage therapist. I'm not even going to say sports. I am a massage therapist, and I do sports massage. But like I used not to be proud to call myself a massage therapist, but I'm getting, thanks to Matt and the other Matt, I'm becoming more proud to stand up and say, yeah, I'm a massage therapist. That's what I do. And yeah, I'm really glad that everyone's coming together and starting to work together rather than working against each other. And I'm really interested to hear what everyone's got to say, and it's great.
Thank you. Thanks. So thank you for that. And I think hopefully what you can see is that we have very deliberately a very multidisciplinary panel. We are all of some of the same ethos in terms of we do all want to strive forward, but we all have different views, and we are interested in different views tonight. That is the point. Everybody has a different way of thinking. Everybody has a different way of working. We all have our own personal opinions about our own profession and how it can develop and evolve. But this is what, you know, this is the reason I wanted to do this. I wanted to start conversations. I guess I'd better introduce myself as well. I am also a physiotherapist. I started the Facebook group, which has evolved, you know, fantastically into a great collaborative network now, purely to help physios and therapists through COVID. And the physio and therapist title was very deliberate. You know, I didn't want it to be just for physios because that's my bias and that's, you know, initially what I wanted to do. But the idea was to create a network where everybody was facing the same problem in the pandemic at the same time, you know, in private practice, in NHS and across the field and in healthcare. And I wanted to create an environment to share things that were going on, and that's what we did. And I am very proud with a lot of these people that you see on the screen to have evolved that group into what it is today. And one of the other reasons I wanted to sort of do this tonight was that this is very much the direction I would like the group to evolve into specifically. I do just need to take a very brief moment, and it will be brief for obvious reasons, is that I started this group with Paula Clayton. She was one of the first people I asked to join. I'm not going to cry. And she would want to push on with this tonight. You know, this would have been very easy to cancel. It would have been very easy to not do. It would have been very easy to sort of say, I don't feel like it. I don't want to talk about this stuff, which I don't, you know, but she would want us to do this. Paula has been working as a soft tissue therapist back in the day. She then trained into physiotherapy. She worked across all different aspects of NHS, private hospital, Olympic sport. She was the very essence of multidisciplinary work. So this even slightly delayed topic is for Paula tonight. She would want us to carry on. And she would want us to carry on with the group and mixing and creating this environment that we work in. So not easy to talk about, but I had to mention it. Obviously, we will crack on now. I have a very rough agenda. It is very large. This topic isn't easy to get into 90 minutes. We are going to try and keep it fairly brief, but it is important. Hopefully we'll get some lively chat. Do comment and we will try and sort of bring up certain topics, but I am interested in what different people say and different people's professions and how they think it's going to evolve. So due to time and things, I might just sort of hop around team about some of the things. I might just pick some of the more key ones that we should talk about. I think what I'll start with is factors that define our profession. Okay, so I am going to start with physio. I'll start it off myself and I will contribute because it was my idea to sort of make this moving forward. And I think what defines physio as a profession. So as Jane said, I am very proud to be a physio, but I also feel like I'm a lot more than that. And I feel that sometimes we can get a little bit hooked up on our own titles as a profession. I think we can become a little bit sort of use it as a bit of a safe place to practice in. And I certainly, developed as a person, as a profession by learning from other people. So whereas I'm proud to be a physio, I also recognize that there's a lot more to that, and there's a lot more to me as a person and the way that I practice clinically because I work with other people, and that's very much the sort of environment I want to work in. So even today, I've worked with a sports therapist in my clinics today because we both have a very different approach. I've worked with osteopaths and chiropractors in my different clinic before because, again, they have a different approach, not only from a professional point of view, but personally in the way that they treat. So, what defines me, or I guess physio, is I think physiotherapy tends to be very traditional. You can agree or disagree. I think there's a lot of people who want to push the profession forward. But I think sometimes because we have chartered status, that clouds actually our thinking in terms of being able to push it forwards. You can still be a chartered therapist, which is lots of people are, but work with different people. And I, for one, think that yes, it's nice that I'm a chartered physio, but that doesn't mean anything to me in terms of what I deliver to a patient. What I deliver to a patient is my skills, my experience, my patient knowledge, what I do in terms of rehab, because I'm a very rehab physio. And that, for me, sometimes I think from a physio point of view, clouds this progression and clouds this ability for us to move forward. I'm going to come, because I know we won't mind me putting under pressure, to Matt Phillips now, because Matt and I have discussed this on his podcast. It is something that he agrees with, I know, in terms of not just physio, but in terms of and the collaborative working is what I meant. So we will go around. But Matt, in terms of yourself and from a sports therapy point of view, what factors do you think define your profession, and how do you think that sort of helps or hinders people from a sports therapy point of view?
Yeah, it's really interesting, and we'll probably see tonight. I think there's similarities in our professions. For example, moving towards a more evidence-based, kind of evidence-informed background. Some professions the foundations are more shaky than others, maybe. But then also there's a lot of differences. I mean, I think I stand proudly in thinking that as far as massage goes, it's still got the shakiest foundations, because I look at the syllabus and the way it's not regulated, and it's some very old-fashioned information being put out there still. And so we kind of deal with a problem where, particularly when you're kind of helping mentoring younger students or students who've just qualified, you have to find a way of saying, look, probably 75% of what you've learned is a little bit simplified. Don't chuck it away, but you're going to have to change it a little bit if you really want to help people in front of you, because we still haven't embraced in the syllabuses that are turned out kind of the biopsychosocial model. It's still very much, even strength isn't really incorporated. It's all based on asymmetries and realigning and posture, and anything hurts, you've got to stretch it. So I think, and I might be wrong, but I think when it comes to anything to do with massage, then yeah, there's a few more hurdles to get through, and we've got to treat the people who study it a little bit more gently. But there's also, what I love is it's come around in a massive circle now, and thanks to communicating between different disciplines, if we all embrace the psychosocial part of biopsychosocial without chucking out the bio part, then suddenly we're all on the same page, and we can have differences, but we'll all kind of have the same foundations and the same base. And that's why I kind of strive to say how being evidence-based is important, whether you want to call it based or informed. If we all take the same criteria together, regardless of what our specialities are, at least we're all kind of working towards a common goal and realize we're working with people and complex humans. So I have no idea if that answered your question, but
yeah, no, and I think
it
does, definitely. I think it's not, we're a forum chat, aren't we? And I think I wanted to just get your view because we had talked about it before. I'm going to come on to Jane, and I think what I'm going to do, team, is just pose questions based on our agenda for time and mix it up, but we can obviously come back to things. So obviously if you think of things you want to mention, then please do. I think that might flow a bit better than asking one question one at a time. Jane, I know you do have to pop up often. Thanks for joining us. I'm going to hit sort of an education question at you, really. And I mean education in terms of educating patients, educating each other, educating the collaborative working. It is part of what you do, obviously, as a physiotherapist. How do you think we can be, I'm putting you on the spot, a bit better in terms of educating maybe our patients, maybe each other? Things like this group and this forum are obviously things, but have you got any ideas about what we can do to start having these conversations a bit better or educating into professional relationships?
I mean, I think obviously this sort of thing can start with undergraduate students, can't it? And similar to what Matt's just said, I think a lot of the undergraduate curriculum in the UK, or that I know about, I can't profess to know about everything, but I think there's so much to physiotherapy as a profession that we try and fit in such a lot of stuff into the curriculum that we do bits of things, but there's not a lot of time and it's difficult to do everything in detail, particularly when you're not just looking at MSK. I mean, MSK is just a really small part of the physiotherapy curriculum. And we talk about an MDT approach all the time with all of our students, but we don't necessarily embrace this kind of MDT. I think the MSK bits is where we talk the least about an MDT. We might mention, obviously we talk about a biopsychosocial framework, but in the other sort of parts to physiotherapy, we're talking an awful lot about collaborating with consultants or the social workers, occupational therapists. And I think we can probably embrace that within an MSK framework a lot better than we do to start to introduce, MDT collaborative working within sports therapy, sports rehab and massage. I think as far as I'm concerned, my expertise as a physiotherapist is different from the expertise of the people that are massage therapists or sports rehabilitators that I work with. And so we work collaboratively really well because their skills kind of fill in the gaps of the skills I don't have. When it comes to massage, when it comes to maybe rehabilitation and strength and conditioning, that's not my strength. So I think, being aware of where other people's strengths lie is something that we can bring into the undergraduate curriculum a lot more. And as well, like I harp on about this all the time, but thinking about how we can look at physiotherapy student placements differently, how we can give physiotherapy students and probably massage students and sports rehabilitation students more chance to experience working with other professions as a student. And hopefully that will start to, increase people's awareness of collaborative working going forward. Where to kind of stick that into a curriculum is really challenging. It's really difficult, but I think it's the direction we probably need to go in to enable us to work more collaboratively together. I don't know if that answers your question.
And I think it's, and I think you're spot on. For me, it's the basics. It's going back to basics. I say this all the time. It's how I work clinically. Imi, I am going to bring you in again. I know you might have to sort of pop off a little bit.
Fine.
I'm quite interested because you are a massage therapist. And, given that you may not be used to collaborative working, you mentioned at the start that, in conjunction with working with people like Matt and other therapists, that's helped you. Can you elaborate on that a bit more? Can you tell us about your experience about coming into massage therapy and how working with other people has helped?
Yeah, so I came into massage therapy, so I was originally a beauty therapist, and then went to a very well-known university to do evening classes and did my sports massage, level 3 and level 4, and which I thought was great at the time. Went out there, started working with chiropractors to start with a big chiropractic company locally, and I thought that was it, fantastic. Did lots of CPD, and I thought I thought I was doing what I should be doing. I thought I was up to date because I was doing lots of CPD, but then just about the same time as lockdown hit, I discovered that maybe I wasn't up to date, and it was all quite a shock. because I only knew what I knew. I only knew what I had been taught from what was on offer. The way into my profession, the way into sports massage was to go and do your level 3, level 4, and then people would recommend CPD courses. You have to do so many a year. Tick, tick, tick. So I thought I was with it. I thought I was doing the right thing. And then suddenly, at the same time as I had to shut my business, my sort of world imploded, and I found out that actually, no, I was really not up to date. I didn't know anything. And it was quite a shock. And I have to say, well, Matt knows, I pretty much imploded. And I was lucky enough that both Matt Scarsbrook and Matt Phillips took me under their wing and really gave a lot of their time to help me. And now looking back on it, it's annoying. And so in the massage world, we still, and I still know, I know someone who's just done the course that I originally did at, a good university. So it's not degree level, but at this university, and they're still being taught the things that I was taught years ago. So that's quite frustrating.
Yeah, and I don't think you're alone in there. And again, this topic is vast, and I think I use probably about 7% of what I got at university.
Yeah.
The anatomy probably being the main thing. So you're not alone, across profession. And it's great to hear that you have met and found people to work with that have not only helped you kind of by the sounds of it clinically and professionally, but actually boosted you up as a person. Now, this is the other reason for me where, I'm very lucky now to call a lot of the people on this screen friends, because, we met through doing the same sort of thing and having the passions. And coming back to Jane's point, that is the important thing. We just need to share. We need to talk to each other. We need to do more things like this to actually say, you're doing a good job. Yes, that's really good. Yes, that's great. And why are sometimes we a bit afraid to do that? Why are we a bit afraid to maybe focus on just being very insular? And again, that's a physio thing. I can say that as a physio. I don't know why we can't just share and say, you're doing a really good job. And I think it's happening more. I think some environments are better than others. But it's really nice for you to hear from from a completely different background to sharing experience. And Matt is amazing at that. All the Matts are. But it is good to now, and now dragging you onto a live stream with everyone that you don't know, that doesn't work. So thank you. But
lockdown has been great in that respect, that I've been able to meet and interact with people, not just in this country, but all over the world, who have been amazing. And I've learned so much. I'm like a sponge at the moment trying to learn all these things. So lockdown has been great because of Zoom. It's given us so much more access to listening to the top people that we might never have, especially maybe more, I don't know if it's more so in massage therapy or not, but we may never have had access to, and the time to listen to a million podcasts as well. No, it's a really good opportunity to meet different people from different backgrounds and learn from them.
Yeah, and I concur with that. And it's platformed me into thinking about things in terms of doing things like this that I may never have done, before. So I'm going to let Jack and Jane have a little chat. I know Jack is keen to just ask Jane a couple of things about some of the comments that she just made before. So, Mr. Chu.
No, that sounded so. In the private chat, I just said, "Can I disagree with Jane before she goes? Don't leave your kid on the side of the street, Jane, just because me and you get locked horns on something." But I doubt we disagree more. I was just doing it for bait, really. There. The thing that I did want to mention though is that, because I hear this not just a bit in what Jane said when she introed, but also generally, is that my position, and I doubt the position of those that are trying to blur lines, is not that there isn't a relevant distinction there, especially between graduates of different disciplines, or that you won't find relevant differences between any two individuals. It's that those differences when people as MSK professionals, especially through a career, aspire to be evidence informed and then apply themselves in a very similar environment to each other. That the differences between a physio and osteo, a sports rehabber, a sports therapist and a soft tissue therapist in those environments, and I didn't need to stop there, but podiatry relevantly different in some instances with regards to regionally specific stuff. But even then, for me, it's that the more that we progress through, and if we're all, and I'll include podiatry in this, if we're all seeing an acute ankle sprain off the street, then in those specific particular instances, there really shouldn't be as much difference there, especially in a mature clinician. Now, my wife is a physio, as we all, most of you guys know, a pediatric acute physiotherapist. We have some things in common. We have a degree in common, even from the same physio school. And we sometimes have clinical reasoning in common, or we aspire to functional change in stuff. But I have so much more in common with who's here with regards to my clinical workload, etc., than I would do with her. And so I know, Jen, you're probably waiting for the disagreement. I'm not saying that there's loads there, but it's just that fundamentally what I think sometimes people, not Jane, of course, people misconstrue sometimes of saying my position about blurred lines is that there isn't then something that is to be a physiotherapist, or then as a graduate physio that isn't relevantly distinct. Sometimes it is, but it's just that the more time passes, and the present company included, and we've had some amusing anecdotes that maybe Rob, I'd love for Rob to maybe share, because I need to shut up in a minute. But we've worked shoulder to shoulder very recently, as you know, Jemma, and it's amusing how sometimes the public will come expecting more distinction between disciplines and stuff, and when fundamentally we share so much. And that's kind of what I wanted to say. And so the point of it being a disagreement was, of course, just for play, really. But I did want to say that just in case that was something that, Jane, you felt I hadn't ever explained well.
No, and I don't disagree with you there at all, really. It's about your journey, I suppose, as a person. Like Jemma said before, it's more than just being a physio or a sports rehabilitator or a massage or a podiatrist. It's about your journey of where you are now, and maybe we've all come from somewhere different, but you're exactly right. If your expertise is in MSK and someone with a sprained ankle comes off the street, you would hope that everybody would have a good idea of what the best way to treat that person is. And if you had two sprained ankles that were two different people, you might treat them in completely different ways, mightn't you? So I totally don't disagree with that at all. But I also think that different people within the same profession are very different, aren't they? So I suppose I'm just adding to the blurred lines thing, really. A lot of the expertise, or where I find myself now in the MSK world, a lot of what I learned came from working in different areas, so maybe in geriatrics or in cystic fibrosis. And maybe that as a physio, I think sometimes we've got a bit of a privilege because it's easier for us to get a job in the NHS and have those experiences. And I think, maybe that is something that the NHS needs to look at a little bit more. And I think Matt Wyatt obviously alluded to that earlier on, is how we can get the best people to do the best job regardless of what their profession is.
I'm going to bring Rob Bevan in here now because, when we talk about collaborative working in MSK, it's not going to be uncommon for us to have the conversation about chiro, physio, osteo, and I don't mean that disrespectfully to any of the other professions, but it is something that I've come across as a physiotherapist and having to explain to patients all the time what the difference is. And I do that, quite openly. And many people will have been asked the same question. And again, with the other sort of specialties that we've got. But Rob, Jack, as Jack said, yourself and I have started to work together, more recently. I've worked with many chiros, probably more in sport and in the US in my time than in the UK. Give me your take. We'd had a little agenda, that I sent you all. Give me your take about working as a chiro in the industry. You are very rehab focused. I know that from working on you, but can you just give us your take from a chiropractic point of view and this collaborative working, and maybe some of the ways you think that it could be a bit better?
So I'll definitely speak to the ways it can be better. I think that the way it falls down is probably interprofessionally. And I think, ironically, if you ask people on the street what chiropractors do, they're probably more aware of it than most chiropractors, most physios, most osteos. And that's the irony in this, is that what chiropractors have done very, very well is branded themselves as back and neck pain experts, generally. And that's what, if you ask people on the street, what does a chiropractor do? They're probably going to tell you some way they treat your back, they help with back pain, they might crack your back. They're pretty aware of that as a bias. Now, that might be because of historical kind of pre-connotations on spinal manipulation, and that's kind of a different conversation. I think where I fall is more probably, as you know me, my personal preferences are, the lines are quite blurred. Me from working with me and other people on this forum, is that yes, to my mind, it shouldn't matter who you see. When patients ask me, and the way we work in our clinic, when someone rings up with back pain, neck pain, shoulder pain, knee pain, and they say, who should I see? our team are trained to say it doesn't matter who you see. All of our team are trained to diagnose and treat you in very similar ways. There might be individual differences between therapists or clinicians, and there might be different. They might use different manual therapy techniques. They might use different exercises. They might give you slightly different lifestyle advice, but that's going to be on an individual basis as opposed to as a professional basis. Now, I might be at one end of the spectrum who's kind of, preaching from that hymn sheet. But I think that's, the way that these things are going, and that's the way they are going. However, I think that maintaining some level of patient choice is important, and that there will be patient biases about who people want to see. Whether they get the same care from seeing a chiro or physio it doesn't really matter to them. A lot of the case, it's who they see, and patients can be very tribal in their beliefs. I'm a chiropractor patient, I'm a physiotherapy patient, I'm a whatever it might be. And so maintaining some level of autonomy, I think, is important in that. And that goes for anything, whether they see a orthopedic surgeon or a neurosurgeon for the same procedure. It's exactly the same debate. The surgeon's doing the same thing, arguably, whether it's a microdiscectomy, but they think that a neurosurgeon is better, and we know how important that rapport is when it comes to patient outcomes. And I've from experience had patients who have been booked in to see me from a referral, and they sit down and say, yes, so it's my knee, and then they see the photo of me on the wall and say, oh, you're a chiropractor. I thought I was seeing a physiotherapist. And then immediately there's that almost breakdown, which has to be managed quite carefully, because they think they're going to be getting a not quite as a good deal as if they were seeing a physio. But then that comes down to education, and that comes down to our role as therapists to manage that. At the highest levels, the associations work very closely, very collaboratively already. But at the lower down the therapist and clinician level, I think that we could be better at less interprofessional bashing, and more kind of collaboration in forums like this and on social media.
Nick, I am going to bring you in there. You've just made a great point in our chat, because we're trying to work at this together to get the juicy bits, I think, out of everyone's experience. So, Nick, again, as a podiatrist and someone with, you could argue a specialist set of skills.
Yeah.
Just give us your take generally on collaborative working, maybe where you think it can improve, and some of the stuff you've just told us in our little chat here.
Yeah, so I think collaborative working is absolutely key, and for me, so we recently, in the last 7-8 months, we recruited different professionals. We wanted someone to help us with the rehab. And for me, when we put the advert out, I wasn't after a set profession. I was after a set person who had those skills. And for me, the title didn't matter. It's more about that person. And I think that's where we need to be heading towards. I think the issue we've got is actually working up on the public's perception of what we do. As Rob sort of said, there may be that connotation that chiropractors only treat backs, and you may get a snap and crack. With podiatrists, well, most people think I just sit there and cut toenails all day. When actually I most probably, don't give me a set of nippers, because I'm most probably dangerous because I haven't picked a set up for God knows how long. And I still have patients who will come to me and say, right, Nick, I've done the rehab, I need to go see the physio for my massage now. Well, actually, I know that's not what a physio does. So actually, this interprofessional bickering we have, I think the only people that bicker about it are us interprofessionally, rather than trying to serve the people that come to see us, aka the patients. But the point I've made, we've recently just redesigned the website, and I decided to try and take a massively different approach, because I suddenly realized that my old website is very much we can treat X, Y, and Z, and this, and this. But then I actually thought, how many patients actually know what a Morton's neuroma is? How many people actually know what Achilles tendinopathy is? And most of it, all they know is they've got an ouchy foot or an ouchy leg, and they want someone to help. So what we've done on our website is actually decided to take all the titles off. So because at the moment in our team, it's podiatrists and GSTs. We just sign patients through the website, depending on what problem they got. In our opinion, which clinician out of the team is best to treat that problem. So for me personally, I have a particular interest in plantar plate injuries, and that's where we signpost people to. One of my other team members has got a PhD around neuromas. That's where we sign those people to. Our GST loves getting people active who have back pain. So that's where we sign those people to. And for us, I was nervous that patients would ask, what profession are you? But actually the patients don't really care because we order everything we do in our clinic. So we know the outcomes we get. We know what we need to improve, and we know what we're good at. We know what patients feel about the service. And I think last time I looked, on average, we've got about a 97% satisfaction rate. And actually, when you look through the feedback, no one actually mentions what professions we are. Some patients know, some patients don't. The only time it comes up really is when someone wants to be treated under healthcare insurance, because there's some, as a podiatrist, AXA don't recognise what I do. So what I've done is I built a network around me. Is I know different physios, because I'll say physios because with AXA it does tend to have to be a physio rather than anyone else. So I know a couple of physios in my local area who are pretty damn hot at treating foot and ankle pathology. So if I got someone with a nasty plantar fascia issue, an ankle sprain, a peroneal tendinopathy, and the insurance company won't allow me, I've still got a network of people that I trust that will manage that for me. And the only people that care what profession that is in that instance is the insurance company, the people that are paying the bill. So I think there are a lot of possible internal barriers and fears within our own professions that we need to break down. And I think we do need to try and break that down, because I think that will then help benefit the patients overall. Sorry, that's my little rant over.
No, it's good. It's, I mean, yeah, fascinating and so important. Leanne, any thoughts, Leanne?
I've always got thoughts.
You're following in Ju's. Yeah, Ju's prodigy in terms of thoughts, aren't you?
We're purple again. I've always got thoughts. So one of the things for me was about, and you know, I was a physio assistant before I became a physio, and as a physio assistant, I wore a pale blue polo shirt as opposed to a white polo shirt, right? And that was the differentiation within the team, that I wasn't qualified. Yeah, even when I was training, for example. And I remember working for the NHS at a time when they brought in name badges. Name badges were not a thing. And your name badge then also had your title. And this came up because there had been audits done that patients didn't know who they were being treated by. Like, what was the name of the person that you saw? Did they not introduce themselves? And I remember them being at physio school, and one of the first things like being taught was, you know, that intro about who you are and what you do, so that it was part of the relationship building. So whilst I think now in my head, you know, when I'm working now, and I work on my own, but I've got, I'm building, you know, clinicians to work with me and building that up. I do think that the introduction of who I am is important, but I know that my patients come with the automatic assumption then that I am a physio. So if I then took on other people and I didn't say who they were, I'm wondering a little bit in my mind how that would be processed. But you've obviously taken that plunge to do that, Nick. I do understand also that patients are buying people, you know, so sometimes you are connecting a patient with someone that you think they fit really well with, and that patient then receives that therapist really well because there's that cohesion. You know, it's almost like there's that trust level. Oh, Nick said that I should go and see such and such, and I really trust his judgment, which then means they don't necessarily need to know exactly what they do, but a little bit of me is saying, okay, can that patient find out who you are? Can they ask? Because to some people, I do think it does matter. In terms of pain, particularly when you're in acute pain and you just need a problem sorted, at that very moment, it probably doesn't. But you're trusting that where you're going, you're getting the right care from the right person at the right time. Does that make sense?
Yeah, and I think we all do that, don't we? I think everybody, you know, every chats that we have on the groups and that you have in, you know, all of your different podcasts that you do and your interaction with other professionals, we all have the same goal. We all want to get the best for our patients and be a good therapist, and we want the outcomes to be really good. And I think in terms of what we're talking about tonight, I guess that, you know, it's almost a surprise then that maybe we don't work better together, and you know, and I think in a lot of instances we definitely do. We're going to go to some of the chat questions in a little while, because there's some interesting topics that we're going to raise, but I think what Nick's done is genius in a way. You know, the patient isn't bothered really who they see. I don't think, you know, they want treatment for their ouchie toe, ankle, back, neck, hand thumb, and I think it's interesting, but it is down to us. And I massively agree with Nick in terms of, I think the way that we need to push this forward is we need to be better at educating patients in this process, in the collaboration, and in definitely blurring the lines. I think blurring the lines is probably a good thing. Ollie Coburn, I know in your practice, especially from a rehab point of view, you see everybody that I've just mentioned, and so in the similar conversations that we have between osteo, chiro, physio, we now have conversations in terms of, sports rehab, sports therapy, sports soft massage, etc. So give me your little take, and then maybe, touch base on some of Nick's comments as well, if you like.
Yeah, I guess I'm going to sit on the fence a little bit as a nod. So in the most part, I wholeheartedly agree with Nick and his approach. I think certainly from a patient perspective, people aren't really too bothered, or at least in 90% of cases, people aren't too bothered. I would say it is important, though, to inform patients of obviously who you are, what your professional background and qualifications are, just from a transparency perspective. But ultimately, all they really want to know is, my knee hurts. Are you going to be any good at actually helping it? What I did want to pick up on, because my ears pricked up as soon as Nick mentioned insurance, was some of the kind of systemic challenges, if you like, around the different professions, and mainly because that's probably sports rehab's biggest challenge at the moment, is how does the system recognise that contemporary and effective care is being delivered by this profession and isn't yet able to be reimbursed, or at least in the most part. And that's where I think professional roles, titles, registrations, etc., do become a factor, particularly in our section of the MSK industry. That leaves us as professional associations with loads of work to do with insurance companies, which is sometimes like talking to a brick wall. And it is definitely an area that needs improving. Because ultimately what it should be about is, one, patient choice. Patients should be able to see whichever profession they like and have it paid for by the policy that covers them to receive that healthcare, and also the wider point around the care that they're receiving, if we're talking about evidence-informed care, should be the same regardless of which profession is delivering it, and it should be the most convenient person, the best person, etc., to see that patient, not who will the insurance company pay it for?
Because it just creates more divide, doesn't it? It creates more divide that we're trying to, all the things that we're trying to sort of, disguise. Matt, Wyatt, thoughts on insurance, this insurance topic? As a physio, you'll have dealt with it for a long time, but any views on that, or anything else from a collaboration point of view as a physio, or anything that you think we can do in practice? I know you're quite heavily involved in the MSK reform. Any views in general so far?
Yeah, I think part of the solution to the insurance problem is all we've talked about getting the insurance companies to recognise it's about competency rather than profession, and actually everybody's perfectly capable of doing it. I came up with a beautiful analogy when you sent us the agenda, so I'm going to use it anyway because I think it sums up things. So I think all professions, all of the professions in question, a lot of our membership are still chasing unicorns. We're trying to poke stuff, release stuff, strengthen a fabled muscle up, which is going to cure all of it. And we probably need to stop that, because that's what puts the insurance companies off in the first place, because we're all doing all this. I think we need to recognise zebras, but not chase them too much. And I think this is where physio stands out, because I think we're intellectual snobbery of physios is that we can name the zebra and his favourite fruit, when actually you still can't saddle the zebra and ride it anyway. You just need to move on. Which brings me on to horses. So I'm not referring to patients as horses or zebras in any way. But I think it's once we've established something's a horse and we're going to handle the horse or the MSK problem, I think it doesn't matter. It's the person who gets on best with that patient, or say the horse that can calm the horse, can work with it, can do what it needs to. So I think that's the key, and I think that's where we need to stop talking different languages, just go to the basics, all do the same stuff, and stop teaching in universities and talking about unicorns.
I love it. And we just end it there. I think that's it, isn't it, in a nutshell? So, but yeah, I mean, Matt, you know, I agree. And I think some of the challenges we face is, and we've seen it on the group, and this is no disrespect to anybody that contributes to the Facebook group, is that we have people who have worked a certain way for a very long time. And I am talking about physios as a bias in my profession, who feel that we should hold on to that. You know, we should hold on to the pillars. I'm going to use the P word, and we should do this. And I just don't agree at all. I don't agree that because things were done a certain way, you know, 20, 30 years ago, that we should be still doing it. Now, I know I've taken that completely out of context, and there's always context to these conversations, but they're the things on the group that I just think, oh, we need to drive forward. We need to change. We need to evolve. And that evolving for me doesn't mean that we abandon the core reason physio started, by example, or any profession started. But I think we have to evolve, and the pandemic has done that. The pandemic's pushed everything forward, not just within MSK, but in healthcare in general and in lots of sectors. And we have to embrace the basics, exactly as you've all just sort of said. I'm going to let Jack and Rob Bevan chew this conversation a little bit more. Look at that. Didn't even mean to say it, and I seamlessly brought in chewing it over. So do chew that fat a little bit. What, Jack, give me your thoughts on what we've just said briefly.
Yeah, I think the question that I think gets begged with regards to the legacy and history is that you know there's always people that are fearful that you're throwing out the baby with the bathwater, that there is a je ne sais quoi to being whatever a discipline it is, and that to blur those lines leaves you're gonna miss something with that, right? The distinction brought something that we might not understand, but it's really relevant. And sometimes people say patients really care, or interprofessionally we should care, or the doctors care, or the referrers care, the insurers certainly do, and that's probably the last, a really challenging thing for us to work on. I think one of the things that I do ponder and really understanding of Ollie's nominal fence sitting is that it's all well and good people like me saying stuff like that when really physios have got it good in many ways, because they've been sort of they are the sort of biggest fish in that pond in many ways, and so therefore they don't have some of the barriers with insurers being weirdly discerning. And it's not discerning at all, is it? It's just a bit of a nonsense legacy thing. So then you've got sports rehabilitators in this particular example, and podiatry, as Nick's explained, then needing to make some quite specific professional points and organise sensibly as a discipline to get those small p political changes. So what I have to be cautious of is to make sure that I'm not constantly giving it big licks about, well, what the disciplines don't matter, stop talking about professional titles and stuff, when sometimes there needs to be self-organising around those titles. And I'm personally very respectful of those things. Now, I think it needs to be very specific for specific ends, and to then, where possible, in the next breath, talk about the similarities, because, you know, that those distinctions are structural rather than sort of, integrated into clinical. But I think that realistically, that's where I'm finding myself sometimes persuaded when sports rehabbers, sports therapists, podiatrists, soft tissue therapists sometimes need to make that case in a really, and not be professionally tribal, but sometimes quite rightly say to physios that, you know, just sit out of this one, and maybe it's another reason people tell me to shut up.
Rob, what do you think?
Sorry, you're breaking up a bit. I missed that last bit of Jack. Sorry, he's completely.
Oh, Jack. I'm going to come on to Matt Phillips again. Sorry, I'm going to come on to
Jack.
your.
Sorry.
It's all right. Your podcast is very successful, and you are massively trying to have these conversations with sports therapists. And I know one of the topics I caught recently is, and I can't remember who it was. Sorry, they said, you know, own the fact that you're a sports therapist. You know, why do we sometimes try and pretend, and not saying that everybody does, pretend that they're not, you know? And I think, I can't remember who the guy was that was on, I'm really sorry, but he was just saying, own your sports therapy title. You know, this is what you are, this is what you do. You play a really vital role. And I think that applies to all of us. And sometimes, as well as, yes, saying, let's blur the lines, do titles matter, which was something that I put to all of you. Well, maybe they do, but maybe your concept of how we use them and how we engage is different. So thoughts on that, and owning your own title, for example, how do we do that?
Yeah, it was David Rhodes, who's a lecturer in Leicester University. Yeah, it was really good. He was basically saying that sports therapists don't stop pretending to be physios, or pretending in the sense of setting their expectations of, I'm not quite as good as a physio, I should really be a physio, maybe I should be a physio. Then the title will just disappear, the trade will disappear, because you're forgetting about all the great things you do. Oh, I just said do. I have to edit that out. But anyway, so yeah, it's really interesting sitting back. I think there's so much that I don't know, obviously, about other disciplines and the way they work. But in my mind, the one thing I'm thinking about is whether it's not working in a multidisciplinary clinic. I was trying to work out the opposite of that. I don't know if it's unidisciplinary or monodisciplinary, but that seems to hold things back as well, because it's when different disciplines come together. Literally, I was so lucky for 10 years working next door to an osteo, working next door to a physio, and starting off by sending people to all of them when I thought that's too much for me, that's too much for me. And then they kept coming back going, that's fine, just keep doing it. And that, I think, set me up as somebody who can just embrace the fact that they're all people coming to us as loads more rather than just the specialism we've got. So I think the biggest challenge is, who would have thought, it's just lack of communication. And the more we can talk to each other and find out like what we do, the more kind of like things we'll find that are similar, and the less differences we've got. But yeah, we've got to stop comparing. I mean, as a head of the sports therapy department, Dr. Rose was saying that there's just such misrepresentation of what physios do with sports therapists, and they don't understand that. I see so many sports massage therapists who think, oh no, I don't want to do sports therapy, I need to be a physio because that's better. And it's like, how did you get this idea? Why do you think that? It's a very simple choice. Do you want to work in a hospital in all different departments? Are you interested in working with older people or children or in intensive care? Or do you want to work with sports people? And they never plan it like that. They always kind of think, no, I want to be the best I can be, so I'm going to be a physio. So basically the whole session was about that, and trying to discuss how we ever got to that stage, and not saying that one's better than the other. It just depends on what you want to do and what you want to be. It's quite a simple decision, really. But there's just so much misinformation out there. And I hope that things like this are seen by other therapists and people from different disciplines, and that it helps kind of, get rid of that misinformation.
Yeah, I agree, and I think that is a problem. We've had a couple of requests from people on the group to actually just do a couple of features where people talk about what they actually do. So that might be something we do take forward. I'm quite keen this evening to get maybe 3 takeaways that we go on and do from a group point of view. One of them might be having a feature. We all take for granted, because we work and we try and push on this topic, that we know what everybody does. But actually, does everybody know what a sports therapist does? Does everybody know what a graduate sports rehabilitator does and sports massage? And if we get some clarity in that, even down to the basics, is that going to help? We've looked. Jack Chew is just poised on the most brilliant sort of photo. So we seem to have lost him for a second. But
can you still hear me? Or
we can hear you. Oh, I can hear you. There are you? You can hear me. You're poised on a great photo.
Isn't it clever? Yeah, I know. I can't seem to shift that. So yeah, quite a flattering pose. But yeah,
I'm going to bring Matt Starsbrook in, who so kindly sort of waited in the wings and took things backstage and forced on the chat. So thanks for that. But Matt, you are a huge advocate, obviously, for soft tissue therapy. There he is, and the practice that you do is hugely multi-professional. But again, on what I've just said in terms of identifying, tell us a little bit about your evolution in sort of massage and sports, soft tissue therapy and that sort of thing. Give us your views.
Okay, well, I mean, predominantly the qualification that we have as vocationally trained therapists, which we know now call soft tissue therapy, was originally sports and radial massage. It was updated to reflect the fact that massage is only one component of what we do, and also because it comes along with, and I can't remember who in the chat said it, but there was some comment about the fact that you put sports in front of something, and that already loads the expectations of the client. And so the title has changed, and so under certain qualifications within the massage therapy industry, if you will. Soft tissue therapy is now sort of becoming a bit more common. And that's because, as like I say, massage is one component of what we do. It's a very important component of what we do. It still forms the basis of what we do. And personally, I think I've been on a bit of a journey the last couple of years trying to wrap my head around that all other touch-based modalities were a whole load of crap and should all be thrown out, and then understanding actually what's going on, what's most likely going on when we are providing touch-based therapies, and therefore why having different approaches is actually very useful. And off the back of that, again, speaking to one of the comments, I'm going to say it was Aidan, and I apologize if it wasn't, but let's say it was Aidan, when who mentioned the fact that it comes down more often than not to difference between individual therapists rather than differences in profession, because you can have two massage therapists who give totally different narratives and provide their client either with a whole lot of positive outlook and self-efficacy, or a whole bunch of nocebo that sends them off in the wrong direction. And yet fundamentally they're both qualified the same, and I think that's probably the case for all professions. So yeah, I have definitely evolved the way I look, and one of the things for me, what I love about this forum is that we're different professions talking about this, and how can we work further forward. What disappoints me is that these kinds of conversations never seem to go very far when you start challenging those responsible for the education at a sort of a higher level. Now, differently to the regulated professions within the massage industry, broadly speaking, we're split into two camps. You either train vocationally through a privately funded school and you privately fund yourself, or you access it through government-funded schemes via massive money-making qualifications. That is predominantly where most massage therapists qualify, and trying to change those qualifications is like pushing water uphill. But because it's essentially publicly funded education, that is where the vast majority of therapists are coming in, and these are people who are being taught stuff that is out of date, and that the industry needs to catch up with a bit in order to support, again, a better multidisciplinary approach. Because if we're all moving in the same direction, that's better for the clients. But if we're still teaching people that massage flushes toxins, we're setting ourselves back a bit.
And it comes back to what Jane was saying, doesn't it, about the education? And I asked her, what do we do? How do we move forward? And she's right. We are, how many of us in whatever profession use everything that were taught at university? And I know a couple of colleagues now that have gone away from clinical practice and into education for that reason, because they want to be involved in changing the way that it's led from degree level. Now, I'm talking obviously from a physio point of view at the moment, but physios, it's just random what we get taught. And I think somebody mentioned, yes, you put sport in front of something, and that happens. If we think interprofessional differences and interprofessional issues within physio, for example, I work with a lot of physios, and my background is in sport, but I wouldn't have a clue about any sort of respiratory blood gases or anything, and I learned that at university. And a lot of the time I speak to patients when I'm trying to educate other maybe younger therapists or students across the networks and patients. When I talk about physios and sports therapists and sports rehab, for example, I say that, I studied university for 3 years, but one section of that was MSK treatment. So you can break that down into 1 year. So I spent 1 year learning how to be an MSK physio. The rest of the time was spent studying, respiratory physio, neurophysio, which is fascinating, but wasn't the field that I ended up in. Whereas as a sports therapist, you spend sports rehab, you spend 3 years or 2 years, 3 years doing specifically that. So, and that's the way I say that, and we work with a lot of sports therapists in my clinic, whereas they're so specialized in rehabilitation methods for a private practice setting, that that is much better than some physiotherapists. And so it's your experience postgraduate that gives you the skills and the qualifications, rather than actually what you studied. And that hopefully is what it comes down to, is your skills as a profession, what you utilize, how you deal with the patient, the decision making that you come. And we need more emphasis on that rather than just the title. So we've got lots of topics here, but I'm going to bring Ollie in to talk about something that gets brought up a lot on the group and in many different areas. Ollie, I'll just let you take the floor and have a chat about.
Yeah, I'm turning up with my tin opener to do a new can of worms, and it's something I see almost on a daily basis, I think, in the comments in our group, and I've seen in the comments tonight as well on the topic of regulation. I think too often people conflate statutory regulation with competency. Because somebody is on a statutory register doesn't necessarily mean that, one, they're competent, or two, that the care that they're delivering is effective and optimal and evidence-based, etc. As probably most of us would agree, the variety of care delivered by a single profession is vast. What one physio does might look completely different to what another physio does. We also have to recognise that there's almost like a hierarchy of regulation. There's self-regulation, where people look after themselves, their own competency, their own standards, etc. Organisational, where it will be done by an employer or a club or whatever. So Connect, great example, internal training, regular audits, etc., etc. And then we have, voluntary regulation, overseen by the PSA, which is now recognised as a contemporary form of regulation, and the more traditional statutory regulation. One form is not necessarily better than the other. The problem in the industry at the moment is that policy, awareness, and everything else hasn't yet caught up, and therefore people feel like they're a lesser therapist if they're not on a statutory register, and it's really not the case. And when policy catches up with the regulatory landscape, and when other organisations like private medical insurers catch up with the regulatory landscape, it really won't matter so much, and hopefully the focus will shift back to, okay, so what am I actually competent in and what am I good at, as opposed to, oh well, what register does my name appear on, and what does that mean? That's my 2 pennies worth. Someone is bound to disagree with me, so please come on down and I'll get my boxing gloves on.
You did open a can of worms, but it's a can of worms and an elephant in the room that is talked about continuously, and I don't think we have answers yet, do we? I think we're coming back to the same answers in terms of it's about education, it's about educating each other, and it's about building each other up to do everything that you've just said, in terms of, let's be confident in what we can do, be proud of where you are and whatever that brings to the table, and just, play your part in whatever that evolves. But there's a huge problem with insurance companies. I think we all know this. But Matt, Wyatt, come on, give me your take, give me your pennies worth or pounds worth.
Yeah, I think I wanted to highlight another elephant in the room, which I think has been alluded to, and it's been my biggest eye-opener in terms of this concept of different professions working across boundaries. It's about professional groups people work with. That often professions are trained to work with different groups and work in different settings. And certainly when I've been bringing osteopaths and graduate sports rehabbers primarily, although I'd love to bring all the other professions into the NHS settings as well, what we're finding is that it's not lack of competency, skills, or ability. It's just they've not been exposed to that patient group. And I think this is why we talk past each other a lot as well, because people will be talking about different things on this call about their different settings. But we're all working in different settings with different experiences, and what works in sport doesn't work in the NHS, and similar with private practice. So I think that's one of the biggest barriers, is we need to be really clear about what setting we're talking about, what competency and skills people need to work in those settings, and make sure the appropriate people come in. And people can change sector, but they need to recognise that they need to develop the skills and competencies to move across sectors. So I think that's really important. I think that's where a lot of the confusion comes about.
Yeah, Yeah, and it is. We're not going to solve this tonight, are we? And I don't think that's the aim. But hopefully, by talking about it, as we are doing a bit more, it just asks a few more questions of ourselves and others. I'm going to just just say a comment that's been made by Rimmer. Do we think the pandemic has helped in some way to bring community rather than competition during lockdown? I've found being a part of an association has helped me to find local therapists who specialise in certain fields so I can refer on or get some advice as I'm a lone working sports massage therapist. Now that for me is what it's all about. You know, again, we're all agreeing and it's all very lovely. And so Catherine, yeah, I think that's great. Leanne, what do you think? I mean, do you think that happens? Do you agree? Do you think that the lockdown has given us opportunity to think, actually, I can scope more? And is that because we're more aware? Is it because we are more aware of each other's professions? Or is it just a different way of working? I don't know. What do you think about that comment by Catherine?
To be honest, my way of working has always been quite interdisciplinary anyway. So I don't think that the lockdown changed that for me per se. But I do think that it gave groups of us that work in that way the opportunity to connect with other people who work in that way. So my network has then grown as a result of that. And I think that's been a difference, because then we had time to connect and time to collaborate. Maybe if I wasn't someone who did that so readily before and the lockdown came, maybe that opportunity would have been different. But I think that, say, for example, just thinking about your group, it was another clinician who told me about the physio and therapist support group. So you sort of join to have a little look to see what's happening, and you're also conscious that you want to stay ahead of the game in terms of, well, what is happening and what alert have I missed, or what do I need to be up to date about. But in terms of that collaborative working, because I feel like it's something I already did, and I felt like I already had space for it, because especially when you work on your own, I think that you're constantly evolving and learning from other people. And this draws me to the point, I feel like I've been wanting to say it all evening. When we are learning or training to become physiotherapists, we are ourselves also growing. And I think it was Jane that talked about that. And at the time, if you're 21, let's say, and you're a student that's just coming out of university, you got your blinkers on, because that's all you've been able to absorb at that time. And it's not until you have your exposures, I feel, with a lot of your patient mileage, that you then start to perceive things in a different way, particularly if you've had good people, good educators who are also quite well-rounded in their thought process, or you work with one or two clinicians that just turn on certain light bulbs for you and just make you think, hold on, yeah, actually, I've never really thought about that. So I think that this embedding, this collaborative working, if it were to be done earlier on, we wouldn't necessarily be having the conversations about, do we think that what's happened now has increased that, because we would already work in that way. I do think that there's been a lot more visibility of certain groups and people who are working more collaboratively, and that's bringing other people on board. That's my personal thought about it.
Yeah, no, and I agree, and I think one of the things that I want to move on to, maybe with Jack, but a few other things, is that we are all agreeing. We're all on this panel because we are all moving this profession forward. But we're talking about this because it doesn't always happen. So we'll start with Jack. But what about the people who find this difficult? What about the people, and not through any, disservice to themselves or the patients? They believe that what they're doing is good, but actually they think that there should be a big difference, or that we should all stick to what we want to do. Or, what would you say, or all of you say, to people who struggle with collaborative working? What's the advice? What are your thoughts?
There's a few different reasons as to why it can occur, and so I've got to generalise a little, because we can't get all said individuals on. But when I've had that conversation, or I observe those, sort of those with more tribal instincts than those on this call, I see the big difference being that what we're describing between us is a combination of person-centred care and, holistic functional rehabilitation, of which we use various different modalities, but to aspire people to better function on the specific goals that they have, right? So you just end up with this sort of mix and match of MSK professions because we're aspiring to the same goals, the goals of the patient. Now, that's us. Those that are somewhat different to that, if I had to generalize, are the ones that then aspire to, they don't necessarily see it that way. They don't examine and analyze and look towards sort of a diagnosis in collaboration with the patient because they have a set of skills and tools that they want to apply, say, to someone, or they identify with modalities that are more typical of their profession or a style of practice that is more based on their particular, say, texts or habits or legacies of that particular profession. Not all the time, but it does seem to happen. And I think that when there are some people that feel incredibly threatened because, as I said before, there is a je ne sais quoi of osteopathy that no physio will understand, and the protection of that, because it's so central to their identity, they then feel wounded and threatened, as if a critique of the modality or of the profession itself or of things that they hold dear as styles of practice, when a critique comes from, say, any of us, or based on sort of what the evidence has found, based, say, on an A versus B, say, trial or some other thing, or understanding of mechanisms of effect, right? We get some physics-based studies that come from what we can and can't do to people's tissues with our bare hands, right? That doesn't just threaten them in terms of them as a professional. It's something that's so central to their identity that they feel personally slighted. And it makes people act out much like we see in any other circumstance, culturally or politically, whereby they feel defensive because they feel like someone's attacked them, not attacked a modality or, say, a profession. And that is why I think that happens, not all the time, but certainly regularly. And the only way I think to make sure we correct for that is to make sure we're not clumsy with our language, and make sure we don't take out the man with the ball, and try and be accurate with our critique. But then similarly, notice when people are doing that. Notice when people are wearing that badge or that lapel that they're particularly precious about, and not dismiss the fact that they're precious about it, but try to understand it and then help to say, we're blurring the lines, not because we think it's trendy to, but because we think that these distinctions are not helping us aspire to better health and education of our patients and to raise the health profile of society, of which we're all aspiring to do. If we didn't think that was the case, we wouldn't be so passionate about it, and maybe we're just on a hobby horse. But because we think that there's such an important outcome at the ends of this, that's why we go on about it, and that tends to cut through with many more, and has broadened this church that we're in.
Yeah, no, I agree. Nick, thoughts on that?
Yeah, I think we have similar issues within podiatry, and I think a lot of it comes down to fear. I think there's there's two things. One, there is, I think, fear around people often maybe that there's someone else that may do a slightly different job that may be better, and there's fear around that. But I think there's also sometimes, especially in podiatry world, I think there is, and I would imagine it's the same in most, let's just call it AHP land, as it were, that there's possibly an issue with around about sort of critical reflection. And sometimes people taking critical reflection and think actually someone's having a go at someone, when it's not that. It's actually us sitting there as a collective, as a team, trying to learn. And we just got to realize in healthcare that the only thing that changes, the only constant thing, we need to keep changing and evolving. And it's quite I was reading a set of notes that I wrote like 2-3 years ago, and I'm like reading them, I'm like, oh my god, what was I saying? I almost need to phone my patients up and say, here's your money back, I'm really sorry for really chatting that rubbish. But that's just in the world where I feel comfortable, and I tend to hang around with people that feel comfortable. However, I do have a lot of clinicians message me independently because they feel nervous around about changing something or raising something because they feel like someone may gang up on them and whatnot. I think there is that fear, and I think there's also with that some education that's needed around about, okay, this is maybe how we present a case, this is how we raise things, and I think that will then start trying to break down some of those barriers that Jack was chatting about with regards to collaboration and whatnot, because we'll get a better understanding, and we'll soon realize that regardless of what title we have, we're all doing it for the same common goal, to help a patient achieve an objective that they want. At the end of the day, that's what we're all here for. We're all here for the same person, that one patient. And I think as soon as we can start trying to work together, and I'll find out why people are unhappy working with one another, because it may be a simple fix. It may be a fear or something they have that actually is something really easy to resolve. It may be that they still need a bit of mentoring. Is, as you alluded to earlier, was that I like the analogy of when you leave university. University is almost like teaching you, learning to drive a car. When you go through your driving lessons, you're not taught how to drive. You're taught how to pass a test and give you foundations. And actually, when you graduate, that's when you learn to drive, as it were. But actually, are there the right support mechanisms out there for all the professions out there to learn actually what we do, how we can support, how we can help everyone grow? Because I think if you actually ask every therapist why we do what we do, it's because we want to help people. So I think that there needs to be possibly a bit more interaction. There's a bit more that we can do, and we need to delve deeper into that, but try and give people a safe space. So that's really skirting around the subject area there, and just
no, I don't think you are. I think you've hit the nail on the head there, really. And I think we all echo those points, and I think hopefully that's what's coming across in this and in the chats as well for people watching. I'm going to give you a couple of minutes to think, because we're going to bring up the topic of jobs, vacancies, and job market, which is we cannot possibly go into in too much detail, and it is actually something I'm going to do the follow-on webinar too, because I think it's another topic which there is obviously a problem not only in our therapy industry but across the economy at the moment. So please all just have a think, interested in your penny's worth about that. But Imi, I'm going to come to you on what we've just been talking about. You're relatively new. You've come from work as a beauty therapist and then now a massage therapist. Can you share with us some of the barriers that maybe you had coming into this sort of profession and some of the things that you struggle with? Do you concur with some of the things that we've sort of mentioned? Is there anything else that you found that was difficult, or you wanted to share at all?
Yeah, I think what Nick said, especially if you're coming in at the sort of lower levels, it can be really intimidating, and you are scared to ask questions in case you look like an idiot. You're scared. And you don't know, and now, I mean, it almost gets worse, because now, who do you listen to? Who do you trust? How do you know? How do you know? But yeah, so I think it can be really intimidating, and I think even in this last year, I've seen the tone change a lot, and people are getting kinder, I think, and being more open to just listening a bit more. I think when lockdown happened, I was learning about all this world. There was quite a lot of quite full-on comments, and if you sort of stuck your head above the parapet, you could quite easily be shot down, and then you sort of give up and go back to your sort of safety zone. Whereas I think now, there are more and more people taking a kinder approach and being open to educate people who, like me, who might not know as much, not in that world as much, but who are willing to learn and really want to learn. But it is terrifying going on a forum and asking a question. It is really scary. So maybe there just needs to be a little bit, groups where people can just go and ask the stupidest question in the world, and it doesn't matter. And there are more people of all disciplines. I think we tend to stay in our little groups. So I'll go on massage groups and sports massage groups. It's only recently I've got through podcasts, really. I listen to a group run by chiropractors about back pain. I listen to sports therapy group. I'm not a sports therapist, I'm a sports massage therapist. I listen to Pilates podcast. And it's through that I'm learning more about different professions and how they're changing. And quite a lot of it is very similar to the way that my profession's changed and learned and developed. I've been listening to the Pilates elephants, and they seem to have gone through a similar change in their world. Yeah. And, listening to the back pain podcast, and chiropractors are maybe going through similar changes. And it's certainly very different from chiropractors in the past that I may have worked with, very different. So my perceptions are being changed. I had certain perceptions of what physios were like and what chiropractors were like. And those barriers are being broken down, which is great. And, you know, we need more things like this to learn a bit more about each other's strengths and what have you.
Yeah, thanks, Amy. I think, and I agree, I think change is happening. I think it's very productive, and I'm pleased again, and I am proud of the group, because that is now what we're able to do. We're able to give people a platform to be open and to not ask stupid questions. And even if you bring it back to the pandemic where nobody knew what was going on or what to do, the ability to ask a question and not feel intimidated and stupid, because there wasn't any stupid questions because no one had a clue, is hopefully highlighted that we can do that more often. And that is what is quite nice, and what's led us to sort of things like this. So thanks for that. I'm going to come. Who am I going to go to? Who wants to talk about the job market? Then put your hand up. Who wants to talk about jobs and why there's no job? Well, there is jobs and no people. Who wants to go first?
I'd like to hear from Rob Bevan about two things there. His podcast was plugged there and mine wasn't, which was very upsetting for me. But
he sat there and was sick, didn't he?
Also, the multidisciplinary aspects of his clinic, I think, are particularly fascinating. I know that many of you have them, and we have a fairly non-distinct hiring policy. But Rob's acting on that and has been for a while. So certainly, I'd love his thoughts if we can.
Do you mean in terms of our specific hiring capabilities, or?
I think so. Yeah. How do you think it? Do you think it will? Do you think your model will be able to proliferate? And have you faced any specific challenges, I guess, with regards to that liberal approach? You know, do applicants find that difficult themselves? How has it evolved?
No. So I think that there will be the patient biases. So that's why we still hold our titles, if you see what I mean. So it's not. We haven't gone as far as it was Nick earlier who was saying they've removed the website, just because from experience, when people are ringing up, patients will have that bias of I need to see a chiropractor, I need to see a physio, and if they have a particular choice, we will give that to them. But for the 90% of people that ring up and say I've got back pain, can you help me? Then as I said, we'll say it doesn't really matter. In terms of the hiring, I will hire or look to hire people across all professions, based on their skills and competencies, which I know that all of these professions have. So I think that blurring of the lines between the professions gives you some protection, because it allows you to maintain staff. If you only ever want to hire chiropractors, then you're obviously going to be limited by not hiring physios, osteos, GSRs, sports therapists, whatever it might be. You're going to be limited in that. So you will offer some degree of protection by widening the scope to your employability, or the pot of people that you can hire from. So I think that's a massive strength of this and of the blurring of the lines, is that where it might be difficult is, for us, I haven't had any resistance to it from hiring. I haven't hired probably enough people. I think we're only at 15 or 16 or so, really. So I haven't really noticed resistance to that. It's probably harder explaining to admin staff the differences, the similarities, and getting them to convey that to patients on telephone calls and on emails, things like that. That's a bit of a challenge. But I think the benefits of it will massively outweigh the cons of it when it comes to the job market, per se, especially at the time at the moment when, there's 10 job adverts every day on the Facebook group, and with 0 applicants. And these are all fantastic jobs that any of us would love to have worked for when we graduated, or even now. But, there's just, far more patients than there are therapists. But that speaks to the role that we can all fill, and it shows that the demand is there. It doesn't matter what the titles are. We're all here, and we all can fill such an important role in our professions, whatever those colours may be, which you wear on your lapel pin, I think, as you said earlier.
Maybe the demand is the problem, Rob. Like, for example, from a physio point of view, a lot of people will say that they feel like they've got a lot of responsibility. There's a lot of accountability. Jobs that we used to take, for example, you're going to go and do your evenings and weekends with sports clubs. Sports clubs can't fill those positions. People don't feel like they're being paid enough, or post-pandemic, why should I give up my weekend? I don't want to do that anymore. I want to spend that with my children. I want to spend that with my partner. I want to see my friends. So those types of jobs, weekends and things like that, people don't want to do. We know that people are also building some of their visibility and their through platforms, TikTok, Instagram, and some will be doing enough to generate revenue in that. There are also, pandemic also saw people doing things that they didn't do on a traditional basis and building a small business out of their interest or their hobby, right? And you cannot deny whether you are doing podiatry, physio, osteopathy, or whatever it might be, when our patients come into us face-to-face or virtually, and this is the thing about the fact of treating so holistically, is you're not just listening to the thing that the patient, the complaint, you're listening to everything. Yeah, and this has seen, I think, an increase in the number of coaches within our profession. So people are using transferable skills and they're going off and becoming coaches and realizing that the demand on them it's different. It doesn't physically need them to be doing the work, and they realize they can earn the same money, if not more, and now take it into corporate. Because let's face it, post-pandemic, the evolution of having to have conversations around work, diversity, inclusion, belonging, mindset, well-being, and who best placed to talk about these things, and those of us that deal with patients every single day.
Yeah. But I think that what that's done, and that shift online for the online, and people putting themselves out there in terms of TikTok, Instagram, and that virtual aspect of care means that patients can choose to go anywhere. They're not limited by location. They're not limited geographically.
Correct.
But then also what it's done is it's promoted high quality care. So it's promoted what people should be looking for. So not only are you limited, you're no longer limited geographically, you also know people know what to look out for and what not to look out for. There's obviously going to be the bad side of it in terms of I want this done to me. But people know that actually because of people like Mehmet Jem, the hip physio, talking about what great hip rehabilitation is. Now patients are coming in and saying, "Oh, actually, but I know I should be doing some exercises after my total hip." Whereas before my other one, I was just left kind of after I was given some stretches and left alone. So now they're directing their care at high quality care because they know what it looks like. And I think the pandemic has done great things in that direction.
Definitely, but I then think if we're talking about recruitment specifically for companies, I think that some of this has then changed what that looked like. Because people have diversified. I don't have to work for you anymore, in order to make my pound.
Yeah, I started a podcast in the pandemic. Same thing. Because I wanted to. Yeah, same thing. Yeah. No, I totally agree.
That's so interesting, and I don't think it's something that I think it was there in the background, Leanne, but I think you've probably put your finger on it there. And I think we are the royal we. I am going to follow up with a very similar sort of panel discussion about everything we've just said in the past 6 minutes, because it's so interesting and it's such an important issue. And rather than saying, right, why isn't the physios, why are all, someone put on the other day, didn't they, where are all the physios? We need to address what the change is and how it's happened and evolving, and change our practice, and hopefully being different, changing, evolving and moving with the times clinically, no matter what industry you're in, will help with that. As well as employing different levels of different people to do different roles, to all do the same thing, like we've all alluded to. The same goal is to treat that patient, to get them better in whatever club, athlete, client environment that you're in, and we need to think about it differently. It is happening, but we've got to sort of push on with that. As I knew, we could talk about this for hours and hours and hours. I'm very conscious that I did want to keep it to 90 minutes, so we're going to try it, aside from the late start. So we are going to wrap up slowly. I'm going to ask each of you, because we've talked about lots of things, and if people are watching now or if they're watching the recording, I want just some takeaway things for people to go, yes, that's what I'm going to do, or that's the change I want to make, or for me in my practice, that's what I'm going to think about a bit more. I'm going to start. Okay, so I've been scribbling down various things, which I may sort of put into a bit of a draft summary at some point. But one of the things that struck me is that we do just need to be kinder. A lot of the things are that it is very professional. We're trying to all do a good job, but it is sometimes too competitive. And that naturally, I think we are all like that, because that's why we're good at our jobs. But actually, we need to big each other up a bit more. We need to inter-refer. We need to actually say, have you thought about this person down the road who's actually very good at that? It is happening. It needs to happen more. I think we need to be better at actually bigging each other up into and across professions. So that's my takeaway. Jack, we'll go around the boxes. What's your takeaway?
I'm going to pick one, and it's going to follow on from what Leanne and Rob were saying, and it's that we need to take the opportunity to, based on the supply-demand shift that we've just been talking about, and drive prices up. I cannot understand why we succumb to allowing base rates to be dictated by, say, the public sector in the private sector, and the drag effect that could have on public sector wages by improving societal respect and value for what we do would be huge. And it's hilarious that we don't think that way sometimes, especially when we're like, we can't get enough therapists to treat this. There's such a massive public demand for our services. It's like, well, we all need to make sure we get prices up, demand more from insurers, or sack them off because we don't need them if the cash payers are willing, if there's waiting lists emerging on insured patient lists. It's just amusing. So we need to get organised and crack on with that. So not just, it's not an overarching point on this wider theme, because I've said enough about that really, and always do. I've got various other panels coming up recently with the Physiotherapy UK, and even the BCA with the chiropractors and stuff. We've got panels to this effect, so I'll say plenty more there. But certainly the fact that we then don't, one of the solutions to this in many ways is that we, those that are delivering quality care, let's get appropriately rewarded for that as people are willing to pay for it, and we're demonstrating our value consistently, and that the camaraderie that we're describing on this and beyond into the group is something that we can collaborate together to raise standards, but also to then be rewarded appropriately for such. So that's my final take.
Great point, Jack. Nick Knight.
Just to build on from Jack's point slightly, and then I'll give my point. A colleague of mine, Jonathan Small, asked a group of patients in one of these self-help Facebook groups about actually what would they be willing to pay to resolve their plantar heel pain. And then he asked the same question to a bunch of podiatrists. And actually, what patients are willing to pay was about 10 times more than what the podiatrist thought they could charge. So I'm just going to leave that point there, because I think that really just echoes on what Jack was saying. For me, I think the one big thing I think from here that we can take away is that we're all doing this for the same reason. So let's try and break down these barriers. Let's have those discussions with our fellow AHPs, and let's get to learn about who the person is. Focus on the person, not their profession, because there are plenty of physios that I know that are really good at managing foot and ankle stuff. I have GSRs that will send me knee pain, our physios that will send me knee, because we all have our own different niches of what we actually really like doing and what we're good at. So let's take time to learn what each of the other do, and let's worry about the person rather than the title.
Love that, Nick. Matt Phillips, hit me with a point.
Probably ringing in my head most of all has been Nick Knight. It's really interesting about taking the titles off his website. I think that's a really interesting thing, and it is about, you never know whether to help the patient. We kind of do it by educating the patient or educating the therapist or trying to educate the people who are regulating the industry. But I think, like, in terms of sports therapists and massage therapists come to me, there's a huge kind of tendency on their own websites or social media to put down all the modalities they do and all the things they can do, and I can do this and all the acronyms and all that. We're really, like Nick says, the person just says, I want to stop hurting, I want to be able to run again. So I don't know. I never know, and I'm hopefully by listening to shows like this, I'll get to know better. But I never know how to make the biggest change. The most quick change is educating people and their expectations, because maybe we're part of the problem. Maybe it is the professional who's giving us all our titles, and it's the old thing of where someone comes in and says my knee hurts, and we'll kind of spend an hour and £80 of their money to say, oh yeah, you've got this special Latin thing going on. They're like, thanks very much, but can you just make it better, sort of thing. So I always wonder how much we're part of the problem. The other thing which I'm taking away is, the whole regulation thing in sports, massage therapy and sports therapy. It's interesting because there is no regulation, and a lot of the time the complaint, or in our own kind of sports therapy association forums and discussions and podcasts, it's like, we need regulation, we need somebody at the top to help everybody know how good we are and what we do. But I'm still not convinced. I don't know enough about regulation, and I hope that we can kind of continue that conversation elsewhere somehow. Because I've got the impression it's probably wrong, and I nearly put this down, but I may be totally wrong, that sometimes the regulation is part of the problem, and that's where I feel that maybe the dinosaurs are kind of the traditionalists who it's in their interest to keep the regulation, because I kind of see it synonymous with the walls. And if we are all moving towards more multidisciplinary care, then surely that means breaking down of these regulations. And I just hope in future I find out and hear from people who are more experienced than me in working for a regulated industry how much the regulation actually does help them. I've seen it stops people from getting seriously hurt, but I don't know whether that's enough of an excuse for their existence. I think we could do that without having these kind of like walls. But yeah, they're the two things which I've picked up. So thank you for that.
Great. Leanne, my dear. What do you think?
She's on mute.
Oh, amateur.
Leanne, you're on mute, mate.
Oh God, I got caught on that.
Only 18 months
on
of
my
practice.
wallpaper, right? Because the comment that Aidan Barry's made is about my wallpaper, and I was taking that compliment.
Yes.
I love lines. What I was going to say, there's a couple of things. So, firstly, it's that the teacher is teaching the student, but the teacher is also learning from the student. You know what I mean? And in what I'm saying, it's that there's always the opportunity to grow and develop, but you must be, they say we have 2 ears and one mouth for a reason. But we need to listen more and speak a little less, and with that, I'm constantly thinking about the evolution of not healthcare, health and care. The way that people want to look after themselves is changing, and it's changing because their knowledge base is changing, and that means we have to change with that in order to stay. We want to talk about evidence-based, and by the time papers come out, some of them are already a couple of years old, right? How are we moving with the way the people are moving? And I think that's important. One of the business therapy lives, I think that we had, Jack. I can't remember who it was I spoke to. Somebody mentioned about the pricing. Don't assess your patient's pocket, was the conversation.
You're not qualified to means test your patients. In fact, it's judgmental to do so, right? But you've no idea what it means to them. Yeah?
Exactly.
Unless you talk to them about it.
You may well be depreciating yourself because you think your patient cannot afford it, And the other thing I wanted to say was I'm a massive fan of educational marketing. And I've spent my 6 years with Distinct talking to the patient. My visibility has not been to therapists. And I've said this time and time again. I care very little about what you think. Right? The patients are coming to me. They want to know what I know. They want to know if I'm going to help to make them better. They want to know if I'm relatable. They want to know, can they tell me everything that they want to tell me? They don't want to feel they've got a stupid question. And they also don't want to think that I think they've got a stupid question. Like you said, they just want to know whether I can help them to get over what the pain is. And I think that when we start to talk more or maybe drive more towards the patient and what they want, maybe the other things will fall into place in terms of governing bodies and things that are establishing our ways of working. So yeah, they're the things for me. I hope that people can take something away from that.
Yeah, amazing points, Leanne. Rob, Bevan, your take home?
Yeah, I think as what we forget is as MSK professionals, we'll always see each other's worst patients, and that's something which we often forget about. In that, if I knew nothing about the physiotherapy profession and only heard from physiotherapy what patients told me, I would assume it's awful. And you would probably say the same thing about the chiropractic profession, the osteopathy profession as well. We all have those biases. So interprofessional bashing does nothing for this. It only harms all of us. No one comes out clean in a mud fight, at the end of the day. So what we need to be doing is, I think, working together at the therapist level, both at our level in terms of intertherapist and also at the therapist patient level, to firstly making sure we're all meeting the same high quality standards, which we know we're all educated to do. But then, showing patients that we are all capable of, meeting the demand, this massive demand of the MSK issues that are out there. And so when patients come in to see us and say, oh yeah, but I need to see a physio, it's my knee, I need to see a chiropractor, it's my back, or I'd never see a chiropractor, I'd never see a physio, we need to be taking the time to educate them, you know, and the old adage, what is it, a rising tide lifts all ship, you know, so rather than disparaging all the differences, we need to talk more to the similarities and the benefits that all of our, you know, separate but collaborative professions can provide.
Thank you, Rob. Imi, thank you again for joining us, new to the team as such, but have you got a little takeaway for somebody that's in your position or any position, a little takeaway thought for what you've heard this evening?
It would just be nice, I guess, if there were more. We have all our little Facebook groups that in our own professions. It'd be nice if there was more online like this, where we could all get to know each other a bit better and learn a little bit about each other's worlds. Every time I get roped into weird things like this, I learn a little bit more, and it'd be nice if we came out of our worlds a bit more, and maybe I'll Facebook stalk some other professionals groups and learn a little bit about what goes on behind the scenes. I think we all make judgments about each other and as individuals and as professions, and it's nice to know that you're wrong. Good to know that you're wrong.
Great point, Amy. Great. Yeah, that's a lovely point, Amy, and I agree. Mr. Scarsbrook.
Well, I'd probably say start with saying to Aidan and Catherine, never believe everything you see online. That's unfortunately not my library. This is what I aspire to eventually. Anyway, no, really my points are, I want to pick up on, again, Nick's point, person, not profession, particularly coming from a massage therapist perspective. You know, we do a lot more as soft tissue therapists, we do a lot more than just rub people. And I'd love for other professions to get that. But I think, you know, we're in the advantage now that, you know, post the last 18 months, there definitely is a shift towards a more holistic approach that clients and patients are looking for. And I think that is what MDT provides. It is holistic almost by its nature. We're all looking at that individual, but from a slightly different facet, slightly different perspective. And I think building on that holistic nature of what an MDT can be, and hell, taking back ownership of what holistic means. You know, that's something I'd quite like to do long term as well. And actually, I think building on that, one of the things that I'd quite like to see a bit more is a bit more multidisciplinary approach in education of therapists at all levels. You know, I can't speak necessarily for the average, you know, physio uni course, but, you know, when was the last time a massage therapist came in and talked about the importance of therapeutic touch? I can speak from a vocational massage perspective and say, when was the last time a chiropractor came in and talked about evidence-based practice? It doesn't happen. And actually, I think if we want to breed therapists who approach healthcare, client care from a multidisciplinary perspective, we have to start at the beginning. What does it mean to be a therapist? Well, it is part of an MDT.
Perfect. Mr. Wyatt, finally. Give me your point.
Yeah, no, it follows on nicely from Matt's point really there and everybody else's points. I think I'd just encourage people to rip up their old JDs, their old hierarchical charts, go back to the basics we've been talking about today of actually what do your patients need? What skill sets do you need to build your MDT team? And then bring in the right individuals for that, rather than saying, no, I've got to have physio, osteo, sports massage therapist, just scrap all that. But what do you actually need in your team and build that out and build it forwards, probably based around your values as well, rather than the competencies we haven't talked about today, actually aligning the values, really important. And then, having some base competencies to underpin that. And as a blatant plug, the chapter on clinical excellence in the MSK manifesto is a good starting point for that.
Thank you, guys, and some amazing points. And I think it is important to have those points with these conversations happen. They are happening more. We need take homes. We need actions now. We're all doing that in our own way. Hopefully, these sort of conversations that happen more frequently will help with that. We are going to sort of leave it there. Thank you to everyone that's contributed. Sorry we didn't get to do too much of the Q&A, but as I'm sure you can understand, we have an incredible panel. I wanted to sort of make sure we heard from them all. Thank you to all of you for your time and for our little glitch at the start. Thank you to Jack for sorting this out. We did sort of bully him slightly, saying it was all a big ploy to get more plugs. But joking aside, what you are doing, Jack, for our industry is phenomenally important. We all do tease you a hell of a lot, but I certainly am very proud to be part of Physio Matters, and I know we all are. And you are making these changes, you know, and you're all, you know, we're all doing lots of different things in our own way. But what you've done with your team and lots of other people, I think we are all very, very grateful for. So I will big you up, following on my point.
Well, bollocks to that, Jemma. That's nonsense. You organise this. You're leading on this work, and we follow because you've brought everyone together. So it's very nice of you to say, but it's actually nonsense. You've made this happen, and in a challenging time, you've just to be clear, you've done Paula absolutely proud. She was a massive trailblazer in this space, and would be incredibly proud of the conversation we've had. Would have been a brilliant voice that we, of course, dearly miss. But your bravery and leadership on all of these things is certainly, we are in your debt to this, and the entire industry is, for bringing us together at a complex time. So bollocks to pointing it at me. You've been the centre of this, and the ability for us to just put it onto this platform, of course, is just because I talk a lot of shit on the internet. So I'm glad I was able to do it, but that's certainly not, that's the least I can do, and it's on you, is this? So well done, and thank you.
Thank you. That's very kind. I hope she is proud. She tells me every day to get a grip, as she all does. And she was, you know, many people go through very challenging times, as she did. And it is important we look after each other. My point that I've finished with, that Leanne, I think, was my favourite one. She wins, I think, the take homes, is that people are changing and we need to change with them. And I think it's as simple as that. And as long as we do that for each other and our patients, I think we're on to winner. Thank you all so much. Thank you, Jack, for your kind words. This will be available everywhere. Please share it if you're listening. Please look back. Please, you know, let's carry on these conversations, and let's be proud to work in and do what we do. Thank you all so much for your time. All right, bye.
Thanks all.
Thanks.
Cheers, everyone. Night.